Hello and welcome to Optimum Live. You're very welcome whether you're joining us today on LinkedIn or YouTube. Thanks a lot for joining us. I'm Martin Croson, your host for today. As always, I'm joined by Tom Heeley, the MD of Optimum. Good afternoon, Tom. How are you?
Good afternoon. Very good. Did you have a good weekend?
Yes, good. Thank you. Yeah, really enjoyed it yourself.
Good. Yeah, good one. Yeah, no, real good. We had a wedding and yeah, it was nice. Good weekend.
Good. Today is number 3 in a series of 4 live videos we're doing on common footballing injuries. We've already looked at groin and ankle issues. Today we're focusing on the hamstrings, a problem that lots of people suffer with, whether you're playing football or other sports. During today's broadcast, if you get any questions, please fire them away and we'll either do our best to answer them during the broadcast or in the comments section afterwards. And if you're watching us on YouTube today and you're not already subscribed, please hit that subscribe button so you're aware when we're on again. Tom, first of all, let's start at the top. Where are your hamstrings and what is the anatomy around that area?
Yeah, I guess quite simply, you've got 3 hamstring muscles, which might be new to you. They're kind of classified as a group of the hamstrings, but you've got 3. So you've got 2 on the inside of your leg, so at the back of your leg.
Good time to pull that up, Tom.
Yeah, perfect time. Yeah, so they're all 3 are at the back, and all 3 bend your knee. And then you can see the long one there, bicep femoris. That one's involved in extending the hip as well. So taking the leg behind you a little bit as well. So bending the knee and taking the leg behind you. And then reversely, they're obviously stretched when your leg comes in front, your knee comes up, and then you start to straighten your leg out in front. And you've got the 2 on the inside. So you've got semitendinosus and semimembranosus there. They're both primarily involved in just bending the knee, and then obviously you've got the longer one, which is involved in bending the knee and also the hip as well.
Yeah. Okay. So there's a lot in there, actually, isn't there?
Yeah, probably more so than what you would realise. You know, if you were to just think about the hamstrings, you might just think there was one muscle, but yeah, to break it down, there's 3 muscles.
Okay, and it is a problem for footballers. And how commonly do these muscles get injured, and in what sort of respects?
Yeah, so typically, I mean, you've probably seen the traditional sort of thing where someone's running and trying to accelerate or even just hitting top speed, and all of a sudden, you know, kind of like they just fall over straight away, or they feel like looks like they've been shot, or they grab the back of the leg, and that could be sprinting on a track, or it could be sort of accelerating and sprinting on a pitch.
And that's where you see that shot reaction, isn't it? A lot in 100 meters and things like that.
Yeah, and just instantly sort of grab into the hamstring. I think the one that sticks in my head was probably. I just remember it being in the game. I think it was Spain versus somebody. It was football, like a final of a competition. Torres is up front on his own. Spain are winning. Everyone's in the box. Spain win the ball back, lump it up the pitch, and he runs after it and just goes down. And they just leave him for like 2 or 3 minutes on the pitch because the referee just carries on playing and he's just kind of hobbling around, can't do anything. So, but instantly you could just see he just pulled up straight away. And yeah, just clutching his hamstring. So yeah, so massively involved in sort of stabilizing the knee. Really important in stabilizing the knee because of how they cross over and how they sort of flex that part of the leg, and also bring the shin almost involved in shin stability as well. And then obviously with the way that it attaches to the pelvis, involved in the pelvis as well. So there's quite a lot of dynamics going on in the area. I guess typically you would see damage when they're sprinting, but it's those mechanics of extending the knee and lifting the knee up in front, so lifting the knee high towards your chest, and then trying to drive the leg out and have a straighter leg before you plant the floor. So it's typically that sort of flick out action that overstretches the muscles, and then that's when you typically get that tear. Typically,
is it worth calling this diagram up now, Tom, just to illustrate the extent of the involvement in the hamstrings that you just spoke about there?
Yeah, I suppose this is probably more. I'll tell you what, put the other one up. That's probably a better one, to be honest. We'll have a look at that one. Yeah, so this one here, you can see the bicep femoris muscle on the right-hand side comes down to the outside of your knee, still on the back of your leg. Now, you can almost imagine if that's involved in bending your knee and bringing your heel towards your bum and also taking your leg behind you, the opposite action is going to stretch that muscle. So if you were to drive the knee towards your chest and then kick it out in front, you can imagine how that muscle gets stretched.
Yeah.
The other picture is more so about other injuries and other things that happen in that area and sometimes confused with sciatica. We can bring that up now. Yeah, so if you were to look at the right leg again there, you can see that blue line that runs from the lower back all the way through to sort of the bottom of the foot and through to the toes.
Yeah.
And then you've got branches coming off that at various different segments, but that's your sciatic nerve, and that passes a long way. So obviously all the way from your back, all the way down through to the ball of your foot. And that sends a couple of different things. So it'll obviously pick up signals from touch at the skin or joint placement or joint movement, and send that signal quickly back to the spine and up to the head, and quickly revert that back to, if you're standing on something hot, get off it, basically, and tell those muscles to contract to get off whatever that hot surface is. But equally, they will elicit those symptoms back, or those signals back down. Now, sometimes you can get a little pinch into that area, so you could get an irritated nerve or sciatic nerve from the back, or it could be sort of as it passes through the other musculature, which could give you pain in and around that hamstring area. And it may well present itself very similarly, but again, kind of as we've talked probably in previous sessions and previous discussions, listening to what patients have got to say and when the pain starts and how it comes on, you can start to rule in or rule out whether that's the case. And also, how far does this pain go? If this pain is localized to just the middle of the back of the leg, you're probably going to say it's the hamstring. If the pain is widespread and global, or the hamstrings stop at the knee, so if it's going beyond the knee, you can probably rule out the hamstrings, to be honest.
Okay. It's interesting. I didn't realize how long that sciatic nerve was, because sometimes as I've got older, I feel a little bit of that sciatic pain, and it's so hard to localize. It seems to be sort of back and bum, and then go down into your leg and sort of stops your knee. Just pain through there. That makes me understand it a lot easier now seeing that.
Super vague sort of pain sometimes. It can be quite broad all over the back of the leg. And you've probably also got to imagine that this is just kind of the main route. There's some other, I don't know if they're quite correct, but there's other little sort of yellow bits coming off and little areas that are coming off, and they're different branches that will feed into different areas as well. So you can imagine how that spreads almost when you get an irritation to that nerve.
Okay. As well as the sciatica issues, then, are there any other? Just talk us through some of the other problems that might arise as a result of hamstring stress, pain, or injury.
Yeah, I guess some of the big things are really sort of, if you've had a sort of a hamstring problem in the past, they're quite persistent and recurrent, so they do come back quite a lot, and that's even when you've done a real good bout of strengthening. So it's really important, even for sort of a good period, 10, 12, even 18 months after your injury, to keep on dripping those hamstring exercises in, just to make sure that problem doesn't keep recurring. And that's a very common thing to happen with hamstring injuries. They're very persistent and recurrent.
Why is that?
I think some of it comes down to obviously the nature of the sport. Hamstring injuries are highly prevalent in football anyway, and that's just regardless of whether you've had one previously or not. I think there's probably a little bit of a lack of attention to continuing those exercises post-injury. So once you're back playing and you're fit and you're back into the normal swing of games, that consistency of keeping those exercises going, I think, drifts a little. And also poor flexibility. Generally speaking, footballers don't have great sort of flexibility through the back of the body. So sort of through the back, the hamstrings, the calf, and that global chain tightness through the foot all the way through to sort of like mid to lower back, it can just put stress through that middle chain.
Okay. I've heard about sort of varying levels of injuries with muscles like the hamstrings. Is it similar with them? Do you have a grade 1, grade 2, grade 3? And once we start moving on to the level of severity, how long is the recovery? And is surgery an option for hamstring injuries?
Yeah, no, definitely. There's again, very similar to what you said there, grade 1, 2, 3. And then we classify sort of A, B, and C as well as to where those injuries are within the muscle. So whether they're sort of down towards for example, for the hamstrings, whether it's an injury towards the knee, right in the middle of the belly, or even up towards the top. We classify them in slightly different ways. But yeah, you can get a 1, 2, 3. Sort of grade 1, you're maybe looking at 4 to 6 weeks, 2, maybe 6 to 8. 3, maybe 8 to 12, maybe a touch longer. It kind of depends on quite where through the muscle that tear is. If it's more towards the tendon, then it can sometimes be a little bit longer and a bit more problematic. And then, surgery's an option as well. So if you have a full rupture where either the muscle and the tendon meet, you can have a full rupture there sometimes, and that needs surgical repair. Or sometimes it can detach almost from the bone, but that sometimes doesn't need surgical repair. It will repair itself with just some proper management and care.
How long does the first surgery option take? Just for the...
Or 6 months. It could take ages.
Wow.
It's a really long one. There's somebody who I know I'm working with at the minute who's what was his surgery date? I think it was the beginning of February. So what are we now? September the 18th. So what you're looking at is 7 and a bit months. And he's had a few issues along the way. Sort of the scarring of the surgery has actually put some compression and irritation onto the nerve, and that's what's giving him some irritation now down the leg. So there's a few complications as well. So it's not just a straightforward just glue the two pieces back together. There's often complications on the back of it as well. So it can take a long time.
Why is the recovery from the hamstring so long? Is it because it's such a big muscle? I know I'm a big American football fan, and 3 of my team's players have picked up hamstring injuries in the last couple of weeks, and I'm sitting here thinking, I know the severity of those things. They could be out for an American football season's only 4 months long.
Yeah,
it could be done. It could be virtually done.
Yeah, I guess most muscle injuries will follow a similar pattern in terms of recovery times. Generally speaking, they'll follow that 4 to 6, 6 to 8, 8 to 12-ish weeks of recovery, kind of what we talked about earlier, what grade 1, 2, 3. But also, it's also on the importance of the hamstrings for the sport as well. So, I'm trying to think, for example, somebody like, and I'm pulling random things out here. So, someone like a hooker in rugby, like a Joe Marler, probably not going to pull the hamstring because they're not going to get into that position very often to stride through. Yeah. Whereas position on a pitch, someone like a fullback or a winger or even a centre, more likely to pull the hamstring because they're going to go through that explosive acceleration sprinting pattern way more often than someone who plays in the forwards. And that's the same in football. Your centre halves are unlikely, or your centre midfielders, because they don't often hit top sprinting or spend a lot of time sprinting, because again, it's a lot of just short movements and longer duration runs rather than flat out sprints. Same with the goalkeeper. But then you sort of your wingers, people on the sides of the pitch, your wingers, your fullbacks, and then your strikers are probably more susceptible to those injuries. Again, that's also position specific, which needs to be taken into consideration with rehab and programming.
Yeah. Okay. So finally, if someone's watching it today and they've got a hamstring injury or they get one in the future, what can you say to them to guard against them coming back too early? Bearing in mind what you just said about the length of recovery, and what can people do to guard against hamstring injuries in the future, whether they've had one or not?
Yeah, so I suppose there's some real simple stuff you can look at doing. Obviously, we would measure flexibility, so that's one of the things that we would look to do. So throughout the stages, flexibility is probably the first thing to try to look to regain.
Yeah.
Once you've regained your flexibility, obviously there's a period within that you can start some strengthening, and then it's hitting some real tough, challenging hamstring exercises. One that challenges your knee, so something like a Nordic curl. So that's an exercise where you are knelt down, feet are maybe held by a partner, so someone maybe sits on your heels, and then you have to keep sort of from your knee through to your shoulders nice and straight and almost fold forward.
I can see that.
Very tough, very tough, and that's almost you can imagine that's more of a knee dominant exercise because the knee's the moving joint, whereas the hips are staying pretty still.
Yeah.
And then something maybe a little bit more like an RDL pattern or a hinge, I would call it, where the leg is pretty straight and still, and you sort of hinge from your lower back or your hips. Back's nice and straight, and you fold forwards, whereas your knees are pretty stiff in that position. So it's kind of two big key components that you need to make sure that you've got in your training, and that can start from early on and just progress difficulty all the way through to the end.
And I suppose the importance of diagnosing what that is as early as possible is really important. So if people have just picked up an injury at the weekend, pop down and see you or give you a ring and pop over.
Yeah, definitely just give us a buzz. I think getting the assessment and the sort of the correct diagnosis early on is key, because those first few weeks and those early days of doing the right things at the right time is very important. And if you miss that sort of stage and you're doing the wrong stuff, it can just add weeks onto the end, and just add length onto the injury, really.
Okay, Tom, if you've just joined us for the first time today and you're interested and you play football, please check out a couple of videos that are already up on the YouTube channel in this series that we're doing at the moment. We've spoken about ankle injuries in the past and how to recover from them. Last week we spoke about groin injuries and how to recover from them. We'll be back next week with the latest in the series of football injuries, Wednesday at 4 o'clock again, so please join us for that. Please check out the YouTube channel for all sorts of injury tips to help you back from some common sporting injuries. And if you'd like to find out a little bit more about Optimum Derby, the website address on the bottom of the screen at the moment. If you watch on YouTube today, please subscribe. And if you'd like to get in touch with Tom directly to discuss any of your injuries or niggles, Tom's email address is on the bottom of the screen now. That just leaves me, Martin Crowson, to thank you again for joining us again. Please join us next week, Wednesday at 4 o'clock for the latest, final one of our football injury series. Tom, thanks a lot for joining us. Have a good rest of your week.
You too, enjoy, and I'll catch you next week.
Yeah, and thank you very much for joining us, folks. We'll catch you again soon here on Optimum Derby Live. Bye-bye for now.